family and I just moved into a house that is less than 1 mile from a large golf course. I'm concerned being so close to the golf course because I know they use lots of chemicals.
Yeah, this is going to shock you guys. Living just within 1 mile of a golf course was associated with a 126% increase of Parkinson's disease.
Wow.
And it showed on the DEXA scan that my bone density is in the osteopenia range. My functional medicine doctor suggested that I take BPC-157 as a potential way to support bone density.
People want to know about the peptides. What would I say here? BPC-157, body protective compound.
So I get ovarian cysts and they are allegedly the normal kind, but she did tell me the only fix was birth control, so I don't want to do that.
When you're dealing with female hormonal symptoms, what would be our take on this? Hi, I'm Dr. Will Cole. Wellness is a sacred art, and you are the masterpiece. This is the art of being well. What's up, and welcome to the Art of Being Well, guys. About twice a month, we have Ask Me Anything episodes where you can answer get your burning health questions answered, and the questions can be about your own health journey, things you're looking to optimize, or someone you love. Maybe some wellness trend you saw on social media, some research you saw in the scientific literature, and as far as wellness, clinical nutrition, functional medicine, all the things, any biohacking questions, we love it all. To get your health questions answered, you have to go to speakpipe.com/Dr. Will Cole. That's speakpipe.com/Dr. Will Cole. And you leave us a voice message, and then we will play your voice message if we pick your question, which we'll try our best to get to as many as possible in these AMAs. But leave us a voice message with your question, and we'll play it live on these AMA episodes. So, and every AMA, we also have a fun giveaway. We're giving away free clinical case reviews with our day job, guys, is not podcasting. It's helping people around the world optimize their health. We've done it for 16 plus years. We started the first functional medicine telehealth clinic. So we see people all continents that there are people. We see maybe some penguins on ones that there is no humans or no humans. We see.
Where is this going?
we see. Look, guys. I don't want to digress, but we've seen people on every single continent. That's pretty amazing.
Other than Antarctica.
That's what I'm saying.
Penguins.
There's researchers and penguins on those ones.
Yeah, I haven't met with anybody there yet. That'd be kind of cool.
But
if you're there,
there's still time.
You get a discount. Yeah.
If your satellite connects.
Use code Polar Bear for. We love our patients. It's a sacred responsibility. And a lot of them listen to the podcast. They become friends of ours because it's a journey. Mm-hmm. It's a fun journey, but it's a journey to really deal with health issues and optimize and come out to the other side of it all. Better, thriving. So you can win a clinical case review where we look at your case and we give you protocol recommendations, things that we would do as far as supplements, herbs, botanicals, as far as care options, as far as lab options, labs we'd recommend based on your health history and peptides, etc. Like a full protocol recommendations. If you win the clinical, you could pick the clinical case review. If you win, you could also win a supplement protocol stack that we have at drwillcole.com. You can shop by protocol. There's viral, there's parasites, there's histamine, there's gut health, hormone health, brain health, on the Art of Being Well, or Longevity RX line is there as well for any people that are interested in supporting health span and mitochondrial health and lowered inflammation. And the third thing you could choose is a free signed book for those of you that still read books. That's a
What are you talking about? I love to read books. A lot of people love to read books.
Well, three of us do, but I mean, people.
Yeah.
Reading's like.
Do you consider listening to Audible? Like, would you call someone a reader?
I'm always doing both simultaneously. Not always.
This is like a thing, though, in the book world. Like, some readers believe that if you're an Audible book listener, that you're not really a book reader.
That. The purist out there. I'm not a purist with most things.
I couldn't care less.
No,
I do both.
To me, I love both. I like a book, and then I'm normally listening to another book.
Mm-hmm. Yeah. Yes, I will read one book and listen to another one at the same time.
Yeah. All the time. I have one paper and one Audible.
I don't listen to audibles. I only read books, but that's only mainly because there's something emotionally relaxing for me to have a physical book, where if I'm listening to something, it feels
I listen to it in the
distracting.
car.
Right.
Yeah.
It's mostly because I'm in a place where I'm
not walking around listening to the book.
If I'm not driving to work, normally my husband's driving, so I actually bring my book in the car and read.
You can read in the car? You don't get car sick?
No, not even a little
can't
bit.
do that.
Bye.
What
Goodbye.
animal are you?
Pass out.
I actually enjoy it. I'll read for hours in a car.
Yeah, but when you're driving, you normally are on the phone with your husband.
Yes, if I'm driving.
Let's be honest. Alan is your... Why do I call him Adam?
I don't know. Alan's going to be so upset.
Alan is your Audible. Let's just say
sometimes
it
the funny thing is that we'll call each other and then we just sit in silence. Like, I don't know.
Oh, okay.
No.
He's my weighted blanket.
I will diagnose that later off camera. Okay, so let's. You could, for a chance to win, guys. This is how you win. You could head on over to Apple Podcasts and rate and review The Art of Being Well there. Tell us what you love about the show. You could leave your Instagram handle in the Apple Podcast review itself, or take a screenshot of that review and message us on Instagram at The Art of Being Well _. And then every AMA, every Ask Me Anything, we will randomly pick winners. Brooke, who's the brilliant podcast manager, will pick the winners, and then she'll reach out to you. I'll sign the book if you pick the book. We'll work on the clinical case review together, the clinical team and I. If you pick that or the protocol stack, we'll ship it out to you depending on what you want. Good luck. And if you have your question, go to speakpipe.com/Dr. Will Cole. But we can get into the first
Does that get put in the show notes?
question.
SpeakPipe.
I don't know.
Brooke, can you do that?
I'm sure it is. I'm sure it's in them.
A little logistical break. Now back to the show.
Sorry, listener. I just want to make sure you have SpeakPipe easily.
They know the podcast is truly uncensored when they hear this.
100%.
Yeah. Okay, what's the first question?
All right. Our first question is from Chloe.
I like that name.
Hey, Dr. Cole and team. I am so excited to finally be submitting one of these questions and a little nervous. But I've been a listener of you guys for a few years now. Spotify likes to tell me I'm in the top 1%, which I'm super proud of. And I also did your AHR program a couple years ago, and it was just absolutely life-changing. I am a completely different person, and I'm just so grateful that I found you guys. Anyways, I am here to ask you a specific question. I am 35 for reference, and I recently got a DEXA scan. And it showed on the DEXA scan that my bone density is in the osteopenia range, specifically in my upper body, my thoracic spine, as well as my arms. My functional medicine doctor suggested that I take BPC-157 as a potential way to support bone density. And I just want to get your take on this. When I looked it up online, it did say it was an experimental drug, which made me a little bit nervous. And then also I wanted to know, I am doing other things to support my bone density, such as increased strength training, compound movements, increasing my protein, or at least trying to. So yeah, I want to get your take on the BPC-157, and I can't wait to hear all about it. Thanks so much.
You can definitely tell she was a former patient when she starts talking about increasing protein and doing the weightlifting. Yeah. That's awesome, Chloe. I wish I knew your last name so I could look up your case.
Yeah, so for people that don't know, AHR is our sort of hybrid telehealth model, which we are now... for those of you that didn't see on social media, the clinical telehealth side, we merged with the Health Institute, which is a longtime friend of mine, colleague of mine, Dr. Josh Axe. We are kind of, what would you call it, amplifying, taking the telehealth to the next level, helping more people around the world. Because we're our main focus. I was going to say bread and butter, but that's like our like ancient grain, non-GMO sourdough bread and our grass-fed raw butter has always been one-on-one concierge telehealth, individual one-on-one. We're looking at labs online, like I just said at the top of the call, top of the episode. But we also had this model to democratize functional medicine, make it more accessible, more affordable, called AHR, which stood for Autoimmune Health Reset, which we launched in 2020. But CHR
Cellular Health Regenerator.
You said want to tell people about it?
Yeah, so our CHR program is an amplification of our AHR program.
So it's opening it up beyond just autoimmune issues, which is a lot of our patients. This is for anybody with any inflammatory problem, any metabolic hormonal problem that's looking to level up their health, but do it in an accessible, affordable way.
And they have not only access to you now, like they've always had, now they have access to other great, amazing clinicians as well.
Dr. Josh Axe.
Yeah,
I can't. I don't know if I can.
We're
make
not
another
officially allowed to say who the other people are.
Other big names in functional medicine that will also be a part of the. What I like to say, is the functional medicine Avengers.
Yes,
yeah, we love a
that.
surprise.
What's that?
Surprise but cooler.
Oh, okay, like a European surprise.
Yeah.
Okay, surprise. Okay.
And we're derailed again.
Okay, sorry, go back.
No, but CHR is an amazing program that it's a great entry point. If you don't know anything about functional medicine, it's fantastic. If you've tried 7 different functional medicine practitioners before, it's a great program. We have taken and culminated decades worth of education, clinical experience through you, through Dr. Axe, through our team, the practitioners. I mean, you're talking, if you added it all up, hundreds of years of education within this program.
Yeah.
And so what we did is
and there's like a brilliant, I would say, eclectic group of healthcare professionals. There's PhDs, there's doctors, there's there's so many different types of people, all part of the Health Institute team.
Yes.
So we're still doing the concierge stuff, and all of that information's at drwillcole.com.
Yeah, that's our one-on-one.
Yeah, so if you still want the one-on-one stuff, it's all at drwillcole.com as far as the labs portion side of it. So just go to consult and you can check us out there. So where do people go to learn more about the Health Institute, the CHR?
Exactly just what you just said. It's thehealthinstitute.com. There's different path forward depending on what entry you want. There's a consultation you can book right away, and then there's one where they can actually do a small custom lab panel and review that with someone before they would enter into care as well.
Amazing.
So there's 2 options. Check it out, thehealthinstitute.com.
Yeah, and we'll put that in the show notes too for people that want that. I didn't plan on that. So let's get into her question right away. Okay, the question was bone loss, osteoporosis, osteopenia. Was she officially diagnosed? She had some bone loss.
Scan.
She had some bone loss on the DEXA scan. What are peptides the right route for bone loss? What else should you be doing? Let's get into what we would do for our telehealth patients. As she mentioned, it starts with food, right? I mean, there's I would not just jump into peptides. So she gave us that context to say, she's focusing on, I don't know, she didn't give specific
Increased
foods.
protein.
Increased protein, which there's a significant amount of data in the scientific literature looking at protein is associated with increased BMD, bone mineral density. And that's really what you want to work on from a nutrient density standpoint is these mineral-rich foods, right? So if you tolerate dairy, grass-fed dairy, which has the protein, but also the fats, but has the calcium, right? It has the calcium, and it has some vitamin D, which tells calcium where to go. So the dairy fats, the dairy protein are going to have the calcium, have the protein, have the fats, have even some, magnesium, all these sort of cofactors that you need to build that bone matrix. The second thing that I would focus on from a food standpoint, I'll get to the peptides in a second. The other foods I would focus on are like the sardines and anchovies with the bones.
Yes.
Yeah.
Which has, again, the proteins, the fats, all the calcium. It has everything that you need. There's a study that found that, and you could supplement with this too, but collagen peptides. I'm talking about peptides. Peptides starts with food, peptide-rich foods as medicine, but supplementing with collagen peptides associated in the research with a significant increase of bone mineral density as well. Other foods, I remember there's a study. It was a conventional study looking at seniors. She's 35, but looking at seniors, it was 5 to 6 guys. You're gonna think this is a crazy study. It was 5 to 6 prunes a day was associated with a significant increase in bone mineral density.
Really?
Yeah, the
prunes.
Prunes.
Well, they're definitely going to the bathroom as well.
Heck yeah.
Yes. Going number 2 in building strong bones.
So,
I mean,
2 birds, 1
that
stone.
sounds like a good day to me.
So seriously. So reason the researchers in that study were postulating that potentially it's just the anti-inflammatory nature of it. But then you think, I was wondering, like, the organization of the study and the intention of it is, I think that's such a general advice for senior citizens, where it's like, okay, focusing on any nutrient density is going to be help in lowering inflammation, and no matter what healthy means, is going to be helpful from a mineral density standpoint. Magnesium, 200 milligrams, about 250 milligrams was associated in an osteoporosis study with increased bone mineral density. So it's part of that calcium matrix. Vitamin D3, K2, which I mentioned it in the dairy fat, but supplementing with vitamin D3, K2, it tells calcium where to go. Normally, people are not deficient so much in calcium. They are deficient in these cofactors like vitamin D3, like vitamin K2, that other fat-soluble vitamin, and like things like magnesium. We see it low on most people. Most people aren't lab deficient on calcium, but they are low in these other things that are instructing calcium to do its job. I was just talking to someone about this, a client about this the other day, because it's kind of the same thing. Their doctor wanted them just on a calcium supplement. And well, that's absolutely fine. I'm like, that's not it. It's not the goal to just be on calcium support. We need those cofactors, or else where is that going to go? And it's not going to be as effective if you're not supporting it synergistically. Yeah, 100%. So let's get into the peptides. People want to know about the peptides. What would I say here? BPC-157, body protective compound. It is made in the gut, just like GLP-1 is. A lot of these things, the healthier your gut is, the more it's going to be making these peptides. The more nutrient dense your food is, the more your body can naturally, endogenously make these peptides. But taking exogenous peptides like BPC-157, it does have promising research. There's actually... There's a 1999 rabbit study. Do you know, that's how far back this peptide research was going to, that found that actually the BPC-157 in the bunnies, it's a bunny BPC study, found that the bunnies, that the bunny's bones, the BPC-157 had, it was comparable to bone grafts. Wow. So does that translate to humans? The limitations of peptide research is a lot of them, as she mentioned, are experimental. They're not. There's not copious amount of human studies, or some cases no human studies, translating that to what does this do in humans, and certainly no randomized controlled trials in this too, which is the gold standard in research. But as far as like the risk, reward, benefit, I would say that this is something to consider as a tool within your toolbox. It's something that we utilize clinically. Right. What's the mechanism of action? It increases the sort of collagen matrix repair. It increases angiogenesis, which is basically making increased blood flow to the area to help repair and help to regenerate, sort of regeneration things. And then we like stacking BPC-157 typically with like a KPV, a TB500, copper peptides. Yeah, which more can effective. Also help with collagen. Which all helps with regeneration, repair, lowered inflammation. So they work sort of synergistically, symbiotically. I love that you're bringing this up though, especially that study, because we get that question a lot. Like, is this like a new experimental thing? The research has been going on for a long time, a very long time. And that just shows you how slow many areas within science is, like the translation to sort of the pop culture science, the awareness of peptides, the explosion of the peptide world. That most of the stuff, because it's been made endogenous, it's made in the body for a long time. This has been in like niche rumblings within the scientific nutrition world for a while. Maybe not, most of them not since 1999, but certainly longer than people have known about it. I don't know. Are you going to give a contrarian view? No. This might actually be controversial, and it may get cut from the podcast. I like when you make that face, because I don't know what's coming. Here we are. Is it about debating rabbits? No. I do love a bunny, though. What I want to say is that that research, I love knowing that, because we have talked about this a really long time within the clinic, not to the degree that we are now, but we as a culture had no problem taking vaccines that had 0 to little studies
within a relatively very short amount of time. But here's something that's been studied for 27 years, and we're still questioning it because there's, quote, no human studies. So to me, it's like, choose your poison. What do you want? Like, do you want something that's a little bit more well-researched for 27 plus years? Or do you want something, or are you being ledly, how would you say that?
Blindly led.
Blindly led.
Ledly blind works as well.
Ledly blind. Blindly led from fear. So which one do you want?
Wow, she went there. It was like a left turn, but
I need a drink.
my
throat is dry.
I didn't plan on that.
I'm just saying.
Yes, she has an axe to grind, people.
No, it's just.
I told you, when she makes that face, you don't know what's coming.
No, I knew. I thought she was going to talk smack on BPC.
Oh, no, I use it. I use it every day.
I was saying, I didn't think that because I know she uses it.
No.
But
I just thought maybe it just something switched overnight.
No, to me, it's just, I hate this. I hate this because it's just like when you want to give a pregnant woman or a breastfeeding woman a supplement, and it's like, well, there's no studies. Of course, they're not going to put a study with pregnant women in it, but it doesn't mean it's contrarily bad.
I get your point where it's like, well, there's things within wellness that there's not enough human studies, RCTs, so it's like the industry, the larger medical world says, let's be cautious. Yeah. So it's not her, the individual, it's like the larger trepidation of the industry.
Chloe's actually asking the right question.
Her passion is coming from that we get a lot of people who come to us almost weary or hesitant or scared, and it's because they are seeing this information of like, this is experimental and nothing's known about
a lot
this.
Of crap
and we're over here like,
actually
there is a lot of that's known about this. First of all, your body produces this. Yeah. So I think I get that because we get
was just
people
my thing. It's just like
who say that.
I don't want. This is the problem with looking at things online without doing it practitioner led. Is that there's a lot of information out there. A lot of good information, but there's a lot of information.
Yeah.
And at some point in time, if you're going to be blindly led, let someone who actually knows what they're doing.
Yeah, I get it. Yeah, so look, there are caveats with peptides. You have to look at purity. You have to look at transparency.
Yes.
They could be made in China with all types of random stuff. So look, there is,
this
is an emerging field, obviously, with the recent FDA sort of shifting of the lists of peptides, making them more accessible so people don't have to go to these sort of black market peptides from
so go to a practitioner-led advice. They should. If you're going to a good practitioner, they're going to vet all this stuff for you. So you're not ordering some random ish off of Amazon.
Yeah. Right.
Get rid of that ish.
That's right. Well, you heard it first, guys. Okay. So I think they answered her question.
Yeah, it did. We gave a lot of food advice, a lot of supplemental advice, and yes, BPC-157, in my opinion.
And then there's the question of injectable versus oral. I think both can have their place, but we should look at the purity, the bioavailability, and the specific case and what that case requires. But we have seen success with both injectable and oral BPC-157 specifically.
Yes.
But peptides as a whole, and we've talked about it in actually that last AMA of sort of the bioavailability of injectable versus oral peptides.
Yeah.
Yeah.
And you can't take all of them, certainly orally. There's some you're going to, at this point, from a deliverability system, you have to do injectable, subcutaneous.
Yeah, there's also even nasal. I mean, there's
some are
many
nasal as well.
There's a lot of different mechanism of action. All right. Next question is going to be from Megan. Make sure my sound is up.
Hi, Dr. Cole. I'm a big fan of the podcast. Thank you for everything you and your team do. My family and I just moved into a house that is less than 1 mile from a large golf course. We live in the Midwest in a suburban area, but we are also close to rural communities, so it would be nearly impossible to avoid farms and golf courses pretty much anywhere we lived. I'm concerned being so close to the golf course because I know they use lots of chemicals. My family is very sensitive to these things. I'm pregnant and I have Hashimoto's and I have 3 small children who have allergies and food intolerances. We've done a lot to clean up our lives in the last few years. We swapped cleaning products, body care products, detergent, cookware, all of that, and it's made a really big difference. In this house, we have air purifiers and a reverse osmosis system for our drinking water. I have a filter for the kids' bath water, and then we're saving for filters for our shower heads as well. But I was wondering if there's anything else we can do to protect ourselves from any damaging effects of living so close to this golf course. It's causing me a lot of stress, and I know that's probably just as damaging as the chemicals themselves. So any suggestions you might have to help us empty our bucket and detox and just be safe would be very much appreciated.
So if you live near a golf course or know someone that does, I would recommend they listen to this.
Yes.
Okay, so...
Or a farm, vineyard, or an orchard.
Yeah, so it's not just golf courses, but it's... Let's talk about this. This is one of the key, one of many, many, many questions that we ask on initial telehealth consultations.
Yes.
And they're like, why are you asking about golf courses or farms or industrial plants or things like that?
Yeah, true.
I want to preface all of this with something she said. The stress and anxiety around this isn't good for your health either.
No.
So I'm giving this with the utmost awareness of that being empowered and being informed so you can make whatever decision that's right for you. That's where it's coming from, not to fearmonger or scare or be hyperbolic at all, right? Really at all. But sometimes we can't deny reality.
Well, you can't do
in the
better
name of
if you don't
pacifying
know
a
better.
situation.
Like,
Right.
How
Like
do you
Maya
do better
Angelou-
if you don't?
Maya Angelou said it best. When you know better, you do better, at least, hopefully, right? So, and sometimes, back to the earlier sort of meditative aspect of this is like change, leave, or accept. That, for anything from a mind-body, your relationship with the present moment and all that it brings you, meaning your home, your family, your situation, something that's stressing you out. Can you change it? Can you leave it? Do you need to accept it? That's anything else is creating inner resistance, anxiety, dysregulation, stress, trauma in your body. So I know that's easier said than done, but anything that's sensitive like this, I just want to put that out there because the mental, emotional, even spiritual relationship with all of this stuff is not, it's something that needs to be taken into consideration. Okay, so golf courses, farms, orchards, all of this stuff.
Yeah.
What does the science show? On average, golf courses use about 4 to 7 times more herbicides and pesticides, chemicals like this, above farms.
Which is insane.
Yeah.
Above farms. 4
Which
to 7
makes
times
sense.
above farms because it's that beautiful green golf course.
For like acres.
Yeah. There was a study that found, okay, this is going to shock you guys. There was a study in JAMA, in the Journal of the American Medical Association, that found that just living just within 1 mile of a golf course was associated with a 126% increase of Parkinson's disease.
Wow.
Yeah.
And compared to someone that lived 6+ miles away. And for every mile, this is an interesting statistic from the study, for every mile, it decreased the risk factor by about 9%. So pretty precipitous improvement the further you got away from this.
Yeah, but we're still starting at 162%.
126%.
126, sorry.
So
inverted that.
126% increased risk of Parkinson's, which is a neuroinflammatory, neurodegenerative
so if you go out
disease.
2 miles, you're still at 100% increased risk.
Yeah.
Yeah.
So this is stuff that's not really talked about a lot. It is an inconvenient truth, to say the least, because it is part of our culture. They build expensive homes around this, around golf courses, and people want the allure of they have, all the perks that they're the pool houses and the communities and all of that, the clubs. It's the Americana dream for many people, especially if they love golf. But I mean, look, if you have the choice to move at some point, I feel that strongly about it. I would not. I don't even like golf to play it, so it's easy for me to say. I wouldn't even play golf unless I am playing at a eco-friendly, good for the environment, good for the humans. Why am I doing that? Why am I exposing it when the people that live there are at 126% increased risk of Parkinson's?
Yeah.
So that's how strongly I feel about it. I normally don't feel strongly, but it's like, why am I exposing it intentionally over a
that
game?
Much.
Yeah.
I get it. Some people love the game so much, and what I'm saying is probably very radical to some people. There are a few handful of eco-friendly golf courses around the United States. There's some in Florida, there's some in California, there's some in the Pacific Northwest, there's some in Massachusetts. So you can look at like big golf, they're normally the big ones, like the big money, like Pebble Beach is eco-friendly. None of them are toxin free, but I would say, if I like golf or a telehealth patient recommended, like I'm going to golf here every day, because some people golf multiple times a week.
Oh yeah.
So if you're doing it randomly occasionally here and there, then I don't want to fearmonger. Like, you have to make that decision for yourself. But if this is something you're doing multiple times a week and certainly living near it or on it, I would want to vet what type of chemicals that golf course is using, because it's runoff, it's shared water supplies, it's when it rains, is it drifting
the air,
over into
the soil, the water, all of it.
Yeah. So now that's the statistics. What should she do? She has reverse osmosis. Brilliant. She's dealing with the water piece already. Mm-hmm. So that's a game changer. She mentioned air purifier.
Yes.
Brilliant. Yeah. That's amazing. She's doing a lot in her own life to change the food she eats. She's conscious of the food she's having to mitigate exposure of other sources, right? Yeah. From food, produce and things like that use herbicides and pesticides outside of the golf course. Just minimizing her toxic burden, right? So I think she's making the best of not an ideal situation.
Correct. Yes.
Long term. But she mentioned she's pregnant. She's mentioned she has autoimmune conditions.
Right.
Hashimoto.
Her kids have food issues. And
right. So so this is kind of tied to the recent news that's been bubbling online around Driscoll Farms. Yes. I know it's not the same, but look, on average, golf courses are using 4 to 7 times more of these herbicides and pesticides than farms.
See, that's what's scary, is it's even more. And then you bring up the news on the Driscoll Farms.
So they haven't heard about this. If you haven't heard about this, Driscoll Farms, it's one of the largest berries you can see in grocery stores. They have conventional berries like blueberries, blackberries, raspberries. Yeah. Then they have organic ones as well. Yes. But they found that farms that are farming berries, and maybe other produce, but it was mainly berries, for Driscoll, the kids around in the area of Watsonville, California, had a 38% increased risk of cancers compared to the rest of the country. So if golf courses are using 4 to 7 times more, it makes you wonder, this research isn't being done, obviously, because of industries, but it is the research that is being done isn't looking good.
Yeah.
So, we should look at more research at the details of it, because causation and correlation are 2 different things. Yeah. And this is certainly more multifaceted than just what we see. But this is a significant component, in my opinion, that should be looked at. That's pretty just common sense. We don't need randomized control trials to look at just common sense stuff. So anyways, there's a big controversy with Driscoll berries. Yeah. The problem with the Driscoll story and the berries and all of the cancer rates in those farming towns in California is that the farms, and this is how these big companies do, they're independent farmers. Mm-hmm. So the liability is lessened for these big companies, because it's the individual farmers
they're
are then
buying
giving
it from the individual farmers.
Yes, exactly. Yeah. So is it just Driscoll? Certainly not. These farmers are probably giving to other companies as well. I don't know how their agreement with Driscoll works. But you're looking at runoff, you're looking at shared water supply, you're looking at the air, all of the different variables here. But there's even a PFAS component for a lot of this stuff. These sort of forever chemical ingredients that are used in some of these herbicides and pesticides. So this is not an ideal situation when it comes to golf courses, when it comes to farms, when it comes to other industries that use these ingredients.
Can I even point out, and sorry, something that I don't think people think about either is this is really any cash crop. So tobacco, marijuana, people inherently, obviously, from a smoking standpoint, I'm not going to be none of us are going to say yes. Any inhalation of tobacco or marijuana isn't going to be good from a lung. That's just a physiological standpoint.
Right.
But what most people don't even realize, they're like, oh, well, I'm taking a gummy, I'm taking a tincture, I'm taking all this stuff. And I'm like, well, was it an organic farm? Because it's a cash crop. So guess what? It's very heavily sprayed. This is for something that they want to protect. Yeah. This is something that people do not, it goes back farther and farther unless you're paying attention to it. And that's really important to talk about because you're seeing an increased risk of 38% childhood cancer. That's insanity. And we've seen studies like this in other countries, which we don't talk about here, but the coffee farms and the cancer rates around those in other countries and the villages that are impacted by this. Mm-hmm. This has been decades of this. And this is something that we need to, it will not change if we don't start changing our buying habits. It's just not going to.
Right.
And so that I feel really strongly about that.
So shop organic whenever you can.
Yes.
Do what's within your budget.
Frozen organic berries are cheaper than regular fresh berries.
Yeah. Right. Shop at places that are more affordable but offer organic produce, like Aldi, Costco, Walmart.
Follow like the Clean 15 Dirty Dozen rule. Like if it has a thicker skin and you're not eating the skin, then it's okay sometimes if you can only get that one conventional, because those pesticides and herbicides won't break through as much as long as you're not eating that skin.
So it's the Environmental Working Group, EWG, which puts out a list every year.
They update it. It's relatively the same. I think there's only been a few things that change. But outside of berries, I'd say potatoes, guys.
Yeah.
Do not like
organic
potatoes, because they spray the ground, they spray the seed, they spray it as it's growing. Like it's insane.
I think the biggest thing for her that
back to the golf course,
back to her question too, this is someone who is trying to do a lot to keep her family safe, her body safe. And for me, if it were me and I'm doing all of this, what I probably would do as a next step, if I'm still worried, is probably run some labs.
Yeah.
Yes.
And one, obviously you're seeing some symptoms and some issues that are going on already. So you could already be doing some lab work, but I would be interested in looking at a tox detect type of screen, like looking at non-heavy metal chemicals, specifically looking at glyphosate levels.
Herbicides, pesticides.
Yeah, those herbicides, pesticides. Now, the thing to consider is that it's a snapshot in time, right? It's not necessarily giving you the total body burden, but if you're doing all of that preventative work and you get a test like that done and we're seeing extremely high levels, I would probably assume, okay, something's breaking through here. And that's where, to me, you could at least start to see, okay, is this just something that's unavoidable that we need to look at? And granted, you might have minimal amounts that are still getting through too. But I think that's probably where I'd go next, is working with a practitioner, a clinic, to get some labs done if you want peace of mind. And still try to keep it mindful. Whenever I go over these labs, I know you do the same too. We talk about this all the time. I try to tell people, like, we cannot live our life in a bubble.
No, because it's maybe plastic.
Yeah, you're not going to be able to avoid these toxins 100%.
No.
We want to minimize them, and we want to make sure we're building resiliency in the body, so that way your body can identify them, get rid of them a lot easier. So this really has to be a full picture. You can't just focus on one toxin, one chemical. We need to understand a full picture here, because these toxins are going to impact the gut. They are going to decrease your healthy bacteria, increase harmful bacteria, impact your gut lining. So
which is where your immune system resides. And
so we really need to understand the full picture. So if you're really worried about this and you're doing all that you can, but you feel like you're not seeing what you thought you would, I probably would start to work with someone.
That's a great point, because it's okay. That gives you, if nothing else, peace of mind to say, what I'm doing is enough.
It's actually offloading some of that burden.
Yeah, you're decreasing your stress, and it's confirmation that the common sense things you're doing while you're living there, and it may be indefinitely, I don't know your situation, then you're good, right? You don't have to stress about this sort of boogeyman that doesn't exist for you, right? It's like you are doing enough to create resilience in your body and for your family's body as well. That's a blessing, and to have that peace of mind that you're being informed, you're not living in fear, but you're just being proactive. That's where we want you to be.
Yes.
And you have to have all of those, right? You can't just be uninformed, living in, or informed and then living in fear. You have to have all of these things together. It's just the way that it is, guys. I wish it was different. I wish we didn't live in this mad world, but we do. Yeah. So it's just like we have to have this both and approach of being proactive, living in peace and confidence, all of it. But if there is something to address, then
Exactly.
You have a baseline from an objective data, and you can see that number improve.
Yeah. And the thing with her is that she's also pregnant, so there is some limitations as to what you can do, supplemental, the detoxification. But for the average person who's not pregnant or breastfeeding, this is what we speak hope into all the time. This is knowledge that gives power, because there's something you can do about it. Even though we live in a broken world, it does not mean that you are stuck this way. Your body is designed to heal. It just might need the proper support, the proper environmental components. And if you can't move, you can't move. Just like if you have a elderly parent you're caring for or a child with disabilities, that stress has to be managed. This is a different type of stress that just needs to be managed in a proactive way. But we can do that, but we need to look at your individual variables first before.
That's a great point. Because you don't want to go down these rabbit trails to just thinking like, oh, this is me. Yes, be informed. It may be an issue, but you don't know unless you.
You don't know unless
confirm.
Yeah. And the stress actually will hinder how the body detoxes too. So again, we have to. There's a bigger picture.
I know it's easier said than done. But, you know, and especially when you're pregnant, it's like you.
But she's doing a lot. Let's just point that out. She's doing more than the average person.
Yeah. And maybe that's all you need to do.
Yeah.
Maybe you're doing enough.
Yep. All right. Next question is from Aspen.
Also like that name.
Hi, Dr. Wilcol and team. So I get ovarian cysts, and they are allegedly the normal kind that grow and dissipate every month. I have gotten ultrasounds, and the gyno says they're normal and nothing to worry about. Like, it's not PCOS or endo or anything like that. But she did tell me the only fix was birth control. So I don't want to do that. So I started doing my own research and found seed cycling and castor oil packs at night to be super helpful. They have both helped significantly. But whenever I'm not 100% consistent on those things, like I'm traveling or, you know, life gets in the way, I will get a cyst, which then will often burst like during or after intercourse for obvious reasons. And just some background, I do want to add that my grandma had gotten cysts pretty bad. And I think she had gotten a vasectomy because of it. My mom never got them. So I'm not sure if it's genetic or not. But I do eat really clean, although I do drink alcohol, which I know is bad for the liver, which I know, you know, can cause your body to not like get rid of estrogen as well. So, but yeah, so I work out daily. I'm pretty low stress. So, you know, I know all those things are important to help reduce inflammation in your body. But yeah, so I think I just also know that the cysts are happening because I'm estrogen dominant, likely. But I just kind of want to know why they're happening, if you guys have any insight or the root cause or how I can prevent them. So thank you so much for your help in advance. Bye.
So when you're dealing with female hormonal symptoms, whether there's cysts or other types of, could be heavy, painful periods, irregular periods, this sort of complex of different symptoms, what would be our take on this? And it's just tied to actually some recent big news in the health world, certainly the female health world. It's the name change of PCOS, polycystic ovarian syndrome. It's not surprising for those of us in functional medicine. We've been screaming about the research for years that PCOS, polycystic ovarian syndrome, was not very descriptive because they may or may not have had cysts, and it was so focused on the cysts and the ovaries versus the new name, which is a lot more descriptive as far as the pathogenesis of the dysfunction of what's going on. So PCOS has been officially renamed as PMOS, polyendocrine metabolic ovarian syndrome. So it is more descriptive. Polyendocrine, meaning it's more than just it's the cysts in the ovaries. It is metabolic, so it's tying in the metabolic piece, the blood sugar balance, metabolic flexibility, and then ovarian syndrome. Yes, the ovaries are impacted, but we always knew in functional medicine, because it was always in the research, again, they need more and more research, and science is extremely slow. Again, 1999, rapid study on BPC-157 peptides. Things take time to change in science and medicine, unless they want it to go fast. Then there's ways to make things go fast.
All of a sudden it's safe for everybody.
Yeah, when it's convenient. But women's health isn't convenient for the multinational corporations for many years. Right now it is, which I'll get into the sort of the conspiracy around this and what people are talking about it, about the name change, the timing of the name change is, okay, back to the name change. We always knew it was insulin resistance, inflammation. There was a metabolic component to this. We saw it on labs every time. Every single telehealth patient, we saw labs on it. So, and we reversed this. We reverse this stuff all the time. I mean, this is not a news to us, but I'm happy from a public health, average
education
person standpoint that's not in functional medicine to understand that PCOS has always been a metabolic problem, has always been polyendocrine, has always been an inflammatory issue, and her she's doing some good things. She's mentioned changing her food, right? And
well, can we talk about the one part of it too, though, that she said that her doctor said the only thing that was going to fix this was birth control.
Yeah.
Well, when all you have is a hammer, everything looks like a nail, as they say.
Yes.
So it's like that's their tool within their toolbox. So
but
of course that's what they're going to say.
It's not a hormone issue, but here's your birth control.
Well, that doctor probably doesn't even know about the name change or the visit. I mean, that's the reality.
They're not on social media.
I mean, yeah, they're not
reading the news
or the Lancet. It's in the Lancet, but your average doctor, this is their tool within their toolbox.
I know.
They've been doing this for years. But plus, the visit could have been before the name change.
It doesn't matter.
To give
it's
fair,
still the
benefit of the doubt.
Yeah. Yeah.
It is the most
Do you really think they have another solution though yet?
No, absolutely not. Because,
It'll be another.
I mean, what does a name change do in the conventional medicine world if the same tools are within the toolbox? So the name change is kind of superfluous. It's not really meaningful. But I'll tell you about the controversy online. But let me go back to her before I get to that.
So
right?
she's doing the seed cycling.
She's doing seed cycling. What's her take on seed cycling? Seed cycling. There is some anecdotal information out there. I'll put it, Brooke, if we could put it, an article that I wrote about seed cycling from drwilcol.com for my full take on that. But yes, there's not copious amount of research, but anecdotally, we've heard people, we've seen people, we've experimented with it as far as N of our patient base. Yeah. And it is a tool within the toolbox to consider. Do I think it's some magic pill? No. Magic seed? No. But it's
Jack and the Magic Beanstalk.
Yes, right. It could be helpful here. And
castor oil.
Castor oil. Which we love castor oil.
Yeah, but she's still drinking alcohol.
Oh.
I knew you were going to come for her on that one.
I know. You know.
We have a bunch of Puritans on this show, me included.
Yeah, but it does sound like she's conscious. She's making lifestyle changes.
That could be a potential problem, or else why would she bring it up?
Yes, but she mentions a lot of we're not seeing any labs. Like where is her metabolic health? Like what are the other components?
Right. PMOS exists on a spectrum. The artist formerly known as PCOS exists on a spectrum. So we have to look. You may not check all of conventional medicine's boxes to be said, yes, you're at PMOS, but you have insulin resistance, you have blood sugar issues, you have inflammation issues. So there's a spectrum between health and health problems. So God, what a blessing. You're not checking their boxes for PMOS.
Yeah.
But do you have other imbalances, dysfunctions, deficiencies that we could be supporting? That yes, the concept of seed cycling is a piece of that puzzle maybe for some people, or maybe obviously castor oil packs can be palliative in this circumstance. But what's the larger picture here of it's not, castor oil pack isn't going to be the only thing that's going to solve your problem. Seed cycling is not going to be the only thing. It could be a tool to consider, to look into, to educate yourself on, but that's where labs and fine tuning can come in.
It's not correcting the source of the issue. It's a symptom relief.
Yeah. So yeah, did I answer everything there?
Yeah.
So I want to get into this real fast. This sort of conspiracy, if you will, that's happening on social media, because people tag me, and what's my thoughts? I made a reel about this because people kept tagging me about it. It was the timing of the name change from PCOS to PMOS. As the people were saying, well, this is convenient. This explosion of GLP-1 peptides of metabolic health, and more people getting put on GLP-1s in this sort of macro dose, Ozempic, Wegovy, form. And are they just creating a new customer base because they're saying, well, rebranding, it's metabolic now, we can put more women on PCOS, which we've already seen the statistics that women are already doing it on their own because some of them have prediabetes or have weight loss resistance, or they're doing it off label on their own. Right. So the tide was already turning with more women using GLP-1s. But was this just sort of the nail in the pharmaceutical big pharma coffin to say, yeah, we want to double down on this customer base, to advertise to them, to get doctors to prescribe them. Now they'll be talking about insulin resistance left and right in their PCP office because they have a drug for it, and beyond birth control, and they will give more GLP-1s. The difference is we're kind of fans of GLP-1 done appropriately, but I don't, the way that the world's doing it, it's not this both and, it's this high dose. If a little is good, more is better. They're not talking about lifestyle. The United States does not have a GLP-1 deficiency, but you could say the gut microbiome is wrecked as far as the average American out there, which produces GLP-1. So let's get the gut body to make it on its own, and then do microdosing, cyclical, pulsed, judicious use of these peptides, and not just GLP-1, but all the different variations of metabolic health peptides have their place in this both and conversation. But it's monopolized and consolidated by big pharma, and it's not these sort of clean, like compounded peptides. It's like, no, it's, you have to get it from that manufacturer, and they own the market, and that's the way it's done.
And they're in macro dosing. They don't even I don't hear general doctors talk about microdosing.
Yeah, or teaching how to cycle it. And
I like the independent viewpoints within the biohacking wellness peptide world. I don't love sort of consolidated, we own this conversation now, because it's a big power and money grab of the manufacturers of these brand name drugs versus the actual peptides. So where do I land on the whole conspiracy? It's more complex than that. This name change has been going on for 14 plus years. There's like 55 different institutions. It's thousands of patients, thousands of researchers and doctors. This name change was a long time coming, back to my earlier statement. Things in health, especially women's health, isn't given the attention that it needs. It's underfunded. It is on the back burner in many cases, and that's the name change was predating this GLP-1 explosion. But is it convenient timing for the manufacturers of Ozempic and Wegovy? And yeah, certainly. So it could be both and even there. Where it's like, okay, cool. This is a marketing cash cow for them. But yeah, that's kind of my take on it. What do you guys think?
I agree. To me, it's just I don't have a problem with using these peptides, these GLP-1s appropriately, but you can't, just like we say, you can't supplement your way back to health. You can't medicate your way back to health either.
Yeah, so you can't peptide your way to health. You could create an environment that is a firm foundation for health, but many people, the research shows, when you stop that peptide, if you're not pairing it, most people are going to gain their weight back.
They're going to gain it back.
And all the symptoms come back.
And there's studies that show that a lot of, because if you're not pairing it with lifestyle, nutrition, metabolic health, gut health, inflammation, some of the weight loss, even some studies, the majority of the weight loss is from muscle loss, not fat loss. So, and then on top of that, Ozempic personality zombies, like they're losing, because they're taking these high doses, they're like, their relationships are being impacted because it's impacting dopamine reward centers. Their love for life, that's increasing depression in some people.
I still get stuck on the fat pad loss, like in your feet and in your cheeks. Nobody wants those Ozempic face.
No.
But I agree. I think that we need to just be mindful. We really need to look at the picture as a whole. I go back to her question, right? Like, you're doing some really good things. You're aware of some things that might be hindering how the body could heal, which is awesome. So let's dive in a little bit deeper and maybe understand why this is starting in the first place. We might have great management tools, but what is at the root? What is underlying here? What has filled your bucket? And whether or not that's you have a similar story to Aspen, or you're just wanting to use GLPs as a tool for another reason, think a little bit deeper beyond that, because I do think that will help you start to understand the why behind what you're doing, and then you can make better decisions to help actually correct the issue while still having it as a tool, which is great.
Some other tools that we like before peptides, food starts with food, but myo-inositol has some really compelling data around cysts and the sort of hyperandrogen levels that can be found on labs, these sort of things like DHT and forms of testosterone. And she mentioned estrogen dominance. You want to be supporting these liver detoxification pathways. So myo-inositol, glutathione.
I was just going to say glutathione.
Berberine has its place. Yes. Of course, nutrient deficiencies like magnesium, vitamin D3, methylated B vitamins, getting those in. I'll put, Brooke, if we can put in the show notes the hormone stack.
There's even adaptogens that would be super good.
Yeah.
The hormone stack on the Art of Being Well supplement line. We'll put it in the show notes so you can. There's just curated things for people that aren't telehealth patients of things that are evidence based, that are pure, that are helpful for not just cysts but hormonal health, metabolic health as a whole.
Chase Tree,
Vitex.
Yeah. We have products with Deng Quai, wild yam, ashwagandha, all these beautiful adaptogens that are also helpful. Because if there's a stress component as well as the hormone component, these are great things to add on.
But food is first. I mean,
Always.
Optimizing nutrient density, getting blood sugar stabilized with enough nutrients and
Cutting
protein.
out alcohol.
Cutting alcohol. If you or someone you know.
Well, and there's different times of your cycle too, where you're more insulin sensitive or more insulin resistant too. So the later half of your cycle, sometimes it can be better to focus on lower carb versus, increasing that.
Yeah, we all see those Instagram memes of the luteal phase now. Those are I'm seeing those more and more frequently, and especially perimenopause.
Are you being influenced?
You are.
Are you being targeted?
I am being targeted. Apparently, I'm perimenopausal since I turned 40, but here we are. But so and then looking leading up to ovulation, eating more cruciferous veggies that are going to help with that liver metabolism and detoxification.
That's a good call out.
So
more
sprouts.
bone broth.
Sulforaphane-rich foods like broccoli sprouts. Good. Sorry.
Yeah, no, it's okay. Bone broth, fasting, these smaller, more cooked foods, easier to digest, things that are more soothing for the body.
Yeah, do some, because you can get your protein in, you can make your vegetables easier to digest. You're not getting bloating from too many raw vegetables, because a lot of times people have this
that increased bloating.
Yeah. So because your gut's shifting as well. So soup, stews, being well nourished, well fed, as far as the nutrient density is concerned. Those are some food and supplement suggestions, but of things we would do. But labs would confirm if there's androgen dominance or is there estrogen dominance, and if so, you have a baseline and you could do something about it. So,
yes, sir.
All right. Thank you all for the questions. Keep them coming. Speakpipe.com/Dr. Will Cole for the next episode. We will, if you want to learn more about all the stuff we're talking about here, the concierge labs, lots of free resources and protocols, all is at drwillcole.com. We'll see you next time, guys.